Hello.
Hi, how are you?
Thank you for your generous introduction.
I wish I could say more. Even better than that, I love that you have people swimming behind you.
Yeah, the house is full of kids.
That's the best,
There's
the
not
best kind of
there's
house.
nothing I can do. I'm outside in the garden because the house is too noisy for our Instagram live.
I love it. I'm so happy to meet you face to face. I want to tell you how much I've admired learning about you, Alejandro, because as you know, people that were raised in the American medical system are kind of very one-track minded. And we go to medical school and we're taught to think one way, but you've been the kind of person that has expanded your medical repertoire and bridging that gap between Eastern and Western medicine. And there's not that many people that do it well. And I am so fond of you, and I am so happy to talk to you.
But thank you so much, and it's an honor for me to be with you.
Now, one of the things I wanted to ask you was, I know you got your cardiology training at NYU, and I know it was basically your personal struggles of,
I did my internship and residency in internal medicine at NYU Downtown
okay,
Hospital in New York, and my cardiology fellowship at Lenox Hill Hospital.
that's right. That's right. Thank you. Thank you for correcting me. That's correct. So when you were kind of done with your cardiology fellowship and you had memorized all those CME trials of coronary artery disease and all the things that you were doing in the ICU and the CCU, I understand, and correct me if I'm wrong, that part of what motivated you to find more answers was that you yourself were suffering from a couple of illnesses. Is that what was the key thing that made you move forward and try and bridge into the Eastern medicine gap?
Yeah, it was only that. It wasn't that I was curious about other things. I was very uh, driven to become a cardiologist and to get into that completely. But because I got sick and I got diagnosed with irritable bowel syndrome, depression, and severe allergies, and I was given 7 prescription medications, at that moment things did not make sense to me, and I realized that, well, if this recommendation doesn't make sense to me, why am I doing the same for my patients?
Mm-hmm. Mm-hmm.
So that threw me off on an existential loop, and I started trying to understand my disease better, and I started with the most concerning one, which was the state of my mind. I thought that I was going insane because I was having conversations in my head, what I was going to tell my boss, and then I would imagine what he would tell me, and I would get stressed because it was the boss at that time was
Yes.
not a nice guy. Anyways, um, I didn't know that everybody's having the same problem.
Mm-hmm.
So thinking that I was going mad and really being concerned about that is that I set off to try to understand. So how does this happen? How do we end up not deciding what we think 99.9% of the time? And on top of that, these automatic thoughts are repetitive and mostly negative. At least they were negative for me at that time.
Got it.
And this is something that so many people are suffering from. So in the search for the understanding of not only why is this happening, but what can I do, is that I stumbled upon one thing that led me to another, that led me to another, that ended up opening my mind to different things that I would have not really even considered, should
Of
I just,
course.
you know, endured my problems like so many people do, and just keep on going, take pills, and
Yeah.
10 years later die of a heart attack.
Yeah, I mean that I think that when you suffer personally and that's like your motivating factor, especially with your educational background, I mean, clearly the medical system was failing you at some level and you were like, there's got to be some answers out there. So I admire so much how you approached it, and you've spent the time in the ashram, and your mentor in India teaching you Ayurvedic meds. One of the things that I'm fascinated about is, just for me being a skin doctor, Alejandro, I've always been fascinated by, I think the skin is a direct reflection of your overall health, and what's happening inside your body. I mean, we clearly know that the gut and the skin is a contiguous tissue, right? Your skin and your gut is contiguous. Exactly.
It
I do that all the
it
time.
turns in.
And you could do that the other way too. But I always tell people that, your stress level, it's not just what you're eating, but that's a huge part of your skin, your stress level, your feelings, your angst, the doshas that you talk about. Tell me a little bit about what you've learned about, just in general, the overall impact of the gut health and skin health. Do you think that's related?
Well, as I always say, and I write in my books, the gut is the root of our tree, right? If the hair and the skin and the organs are like the leaves and the flowers and the fruit, then the trunk is all your blood vessels, and the roots are your intestines.
I like that.
And just like a tree sucks its nutrients from the soil through the roots and sends them to the rest of that organism, we suck our nutrients through our gut, and the
Yes.
soil is just portable.
Mm-hmm.
Right? Instead of us being fixed and planted in the soil, we get the soil and we put it through the root
Roots.
processing machine.
Uh-huh. Uh-huh.
Yeah. So that is where health and disease begins.
I agree. And I mean, just reading a little bit about your Clean 7 program, the other thing that I love that you did is, I know your original kind of, food-based program and your clean program was a 21-day program. But you began to realize, from what I understand, is that 21 days was a lot to ask of people. And so as a physician, you can prescribe things or recommend things all day long. But unless the patients are doing it, it's not going to work. So you strategically, figured out a way to kind of condense the program into a 7-day program. And I thought that was marvelous. Are you seeing that there's more compliance there?
It's not about condensing the program. You cannot
Okay.
condense what happens in 21 days, and you cannot reproduce it in less time. You cannot condense a pregnancy of 9 months. It takes nine
Yes.
months to make a baby, right? And it takes 21 days as minimum for certain processes to be restored and reversed, and inflammation to be calmed down. So
Mm-hmm.
but what I wanted to do is I wanted to find a stronger way of doing 7 days than just doing the first 7 days of the 21-day program.
Got it.
So and even though the first 7 days of the 21-day programs are already pretty good, I wanted people to be so inspired by the end of 7 days that they really want to continue. And that is why I brought into my first program, which is based on principles from functional medicine, I added principles from Ayurvedic medicine, and I added intermittent fasting just to accelerate and potentiate things so that in 7 days, people get such an experience
Got it.
that
They get motivated.
they get motivated.
I hear you. I hear you. So, in general, that the 4 R's that you talked about, can you go over those a little bit? Because I think those are really fascinating. And I think that it
So
pertains to overall health.
that comes from functional medicine. It's actually 5 R's.
Okay.
So the first one is remove. You remove all the sources of xenobiotics, of toxins, from your cosmetics, from your cleaning products in your home, from your
Mm-hmm.
furniture,
So remove.
from your remove obstacles. So remove toxins, right?
Okay.
The second one is to re replace. So you replace or restore or bring whatever is lacking. So you provide all the nutrients that we know the liver needs in order to do its work, and every other system in the body. So you really provide everything that may have been lacking or that is needed.
Okay.
The third one is in remove. There's also the removal of the bad flora, whether it's with herbal antibiotics
Mm-hmm.
or other things. You remove the bad flora. So remove, restore, um, re-inoculate.
Yes.
So you re-inoculate the good flora so
Got it.
that it can thrive, and you feed it in the right way. Then there's repair. Fourth R is for repair. So
Mm.
there are certain special conditions that for repairing the lining of the intestinal gut on the intestines, the gut wall, the one that gets broken and leads
You
to
need a repair.
hyperpermeability or leaky gut, right?
Mm-hmm.
So the repair of that wall is going to be accelerated and supported with extra certain things like uh, like L-glutamine and marshmallow root and other things, right? And also allowing the time for digestion to be happening at a minimum, because when digestion is happening at a minimum is when the repair mechanisms
Yes. Yes.
really intensify. And the last one, but not the least, is relaxation. Because
Yes.
every condition that is affecting humans today is at some level influenced by stress.
Absolutely. I see, as you know, the skin is part of the ectoderm, which is part of the brain. And there's a huge GI neural connection, irritable bowel syndrome, as you know, inflammatory bowel. But there's also a huge cutaneous neural connection. I see a ton of people's stress affect their skin every single day, not just acne, psoriasis, eczema, but it's huge. Um, and it's so hard to be a dermatologist when someone's coming to you for a prescription and you're telling them, do more yoga and meditate more. So I can't tell you how pleased I am that you're basically infusing a lot of these, sometimes minimized effects of, the relaxation, the meditation, and the yoga, because nobody realizes how powerful that stuff can be on your overall health. And I definitely see it in the skin. I'm wondering though, one of the things that I really love that you've explored is the concept of being these molecules that basically, help us stay at a homeostasis level and allow us to tolerate stress better. And I'm curious, what are your favorite ones and what do adaptogens mean to you when you talk about them?
So plants have an incredible intelligence, and medicines from plants are really powerful. In India, for thousands of years, these plants have been used for all kinds of ailments, and lately we've been able to scientifically demonstrate that they have very strong effects on regulating and modulating the whole hypothalamic adrenal axis and the stress response. So they make you more resilient,
Correct.
and they are able to do that in a very intelligent way, so that if your adrenals are low in energy, they bring it
Mhm.
up, and if your adrenals are too high in energy, if you have an hyperadrenergic state, they bring it down. So they go in, they see what they need to do, and they do it. And some of these herbs also down regulate the inflammatory response. We
Yes.
know now that chronic the chronic diseases of the modern world, the real tragic pandemics of the world. You know, diabetes, cardiovascular disease, cancer, autoimmune diseases, and so many others. Some that affect the skin specifically, like psoriasis and eczema, that you know, reduce the quality of life of so many. Right?
Yes.
Are yeah are directly related to inflammation. Sometimes inflammation starts 10, 15 years before the disease is even
Of
diagnosed, right?
course. Yes.
So anything you can do to help that system, which is obviously overtaxed, overstimulated, confused, then you will do better in these times. You know, there may have been times on earth that these things were not needed as much, but right now they are, and thank God that nature provides them. And I found incredible benefit in using them. There's one, for example, called shatavari, which
Okay.
is like it's like magic for female hormonal balance.
Okay.
And I would offer you to send you a box, and for you to try it on some of your patients,
I would love
in
it.
which you and then you tell me what you think. You know, the herbs that I am talking about are herbs by this company called Organic India, one of the most incredible companies that I've come across. So much so that I became the medical director and ambassador, and these are herbs that are planted according to um, the way that the Indian scriptures describe they should
Yes.
be, you know, planted and harvested and prepared and packaged and bottled, and they're all organic, biodynamic, fair trade, and the whole 9 yards. But the most important thing is they really work. I've been
So one
using
of
them
the
for
things
10
I just want
years.
to tell the viewers, for those of you that chimed in late, I'm talking to Alejandro Junger, and he is one of the world's leading experts on functional medicine. He's a New York-based cardiologist, and we're talking right now a little bit about adaptogens, which are, you know, basically molecules, and he's an expert in Ayurvedic medicine and how these can calm down.
I wouldn't say an expert. I'm just
Okay,
beginning to
but to me
study
you are.
it.
So what was the name of that that female hormone herb that you said that you want me to try?
Shatavari.
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 Okay, great, awesome. We will want to try it. As you know, I really think hormones are a huge impact on the skin and aging and overall vitality. And I'm just curious, in your experience with your anti-inflammatory kind of clean-based diet, do you see clean living affecting hormone balance and just hormones in general?
Of course. Of
Tell
course.
me a little bit, like, is it just
All,
because you're decreasing cortisol and stress and it's all connected? In general, do you feel men are more, you know, when they're healthier, they're more sexual, that's for sure. But as far as just stress and female kind of calmness, do you see all that stuff interplaying with a lot of the diets and the herbs that you're recommending?
we are animals that were designed by nature to live in an environment and in conditions that nature also designed, which are very different from the conditions we are living in now.
Correct.
We are eating in an unnatural way. We are living in an unnatural way. So that in itself, you know, the fact that we eat breakfast, lunch, and dinner, which is totally unnatural, all these things that we take for granted, that we even consider healthy, um, are putting our bodies into adaptation and survival mechanisms. Now, depending on your, you know, conditions, like
Yeah.
depending on your age, depending on your toxic burden, depending on many
Yes, yes.
things,
Your
it, the,
genetics,
the, the,
even, yes.
the adaptation mechanisms are actually going to touch all your systems, not only hormonal systems. They're
Yes.
going to touch your you know, musculoskeletal system, your nervous system, your digestive system, your immune system, right?
Yes.
And at some point, the hormonal system is going to become involved in trying to adapt to whatever it is that you're
For
trying to
sure.
adapt, right?
For sure.
And some people, that's for some people, that's the weakest link, and that's where symptoms are going to jump out, you know.
Mm-hmm. Absolutely. I
For
mean,
sure.
for me, I do think that the gut, let's talk a little bit specifically about fasting and how, giving your body, and this is, one of the things for those of you that don't know, in the medical community, fasting is extremely popular and it's a very well researched concept. And that is giving your gut time to restore and heal itself, because food in general, especially the foods we eat in this country, are very toxic to the body. And your body's constantly being bombarded by it because we're eating too often, we're eating the wrong foods, and the toxic burden is affecting our whole overall health. And so Dr. Junger is a huge proponent for intermittent fasting. And for those of you that don't know, fasting there's different theories out there how you should fast, how long you should fast. And you can go back into spiritual texts that talk about fasting for days and how it connects you to the spirit. And there's all sorts of holistic ideas about fasting, both medicinal and spiritual. But Dr. Junger, I'm curious because I fast myself every, your 10 p.m. to 10 a.m. fast, meaning eating nothing. Are you still, is that what you're still, what you still endorse in your patients, or does it depend on the disease you're working on? Tell me a little bit about what you recommend to almost everybody for general health.
So I'll give you a better answer than just specifically in terms of timetables and hours, right?
Okay.
Take a zoom out view and
Okay.
start looking at the whole subject from the point of view of what nature would do, right?
Okay.
So because when you look at animals that are living according to nature's design, they don't get chronically sick like we do. So what is it that is causing that? Is that we
Yeah.
are living outside of the rules of nature. So what if I was living according to nature, that without supermarkets, without refrigerators, without
Yeah.
packaged foods, without
Yes.
anything? How would I be living? I would be mostly running around looking for food and eating it when I found it. We'll have a
Exactly.
feast, and then maybe rest for a couple of days, or depending on how much you eat, and then go look for food again.
Got it.
So I believe that in our evolution, for much longer time than what we're doing now, we've been intermittently fasting and feasting as imposed by nature.
Got it.
It is only in the last 100 years that we have food available all the time, maybe even less than that. So
Okay.
our genes have not had time to adapt to
Correct.
us eating
Yes.
4 meals a day. So what you're doing by intermittently fasting is just setting up the clock for your genes to recognize
Exactly.
what it is to exist in a normal, natural way. And it's just incredible, the results that I see. Now, I do not have one set of timetables to recommend to people. I myself don't have a set of timetables. I play with it. Some days I don't have breakfast. Some days I don't have breakfast and lunch. Some days I don't have breakfast and dinner. And it all depends. And how I'm feeling at the moment, and my levels of energy.
Got it. So in general, I mean, do you feel rejuvenated when you fasted? Like, do you feel energy, or does it actually slow your body down? I'm just curious.
I feel fantastic. I feel awake, alert. I feel connected.
Yes.
Because
Yes.
because food grounds you. What happens is, suddenly when you eat something, all
Yes.
your body's attention is going into digestion. your blood is going there, your muscles are moving, so your nerves are activating, your digestive juices. So when you see where is all the electrical activity, which which indicates activity, right? Cellular activity. Where is it happening when you're digesting? It's all here, right? So that sucks so much energy and attention. Sometimes it puts you to sleep. If you eat a big meal,
Yes, yes,
you're gonna
yes.
doze off, right? So yeah, the less you eat, the more awake you are. And if you think about it, nature designed it that way so that when you're really hungry, you're really awake and you can go hunting or
Yes, of
finding.
course. That's evolution, right? That's what we're meant to do. So true.
Yeah.
Well, for a skin doctor who sees a lot of problems on the skin from an inflammatory standpoint, besides fasting and eating clean, what other kind of anti-inflammatory activities can I, recommend to my patients just in general?
Um, More contact with nature. It is scientifically proven that when there's a practice in Japan, I forgot its name, Jinjun something,
Yeah.
that basically means going to the forest and breathe, take deep breaths. Because when you're breathing the terpenes, which are volatile phytonutrients, right? That are responsible for the smell of certain of all plants that we know now are biologically active compounds that have all kinds of modulating and regulating effects on stress and other functions of the body, right? So being out in the air, it is known now, scientifically proven, that breathing
Someone just
outside.
wrote forest bathing. That sounds fun.
Yes, that's what it is, but I don't remember the Japanese name, right? So so um also it also strengthens your immune system, right?
Of
So now
course.
I tell all my patients, open all your windows and go out, even if you
Yes,
have a
yes.
balcony, just breathe the air outside, being out in the sun, moving your body, going for a
Moving your
walk,
body.
jumping, dancing, right? All those
Mm-hmm,
things are
mm-hmm.
incredibly beneficial, but so much so that when we listen to them, we don't realize how important they are. We just, yeah,
Well,
everybody
I want
says
to
the
say
same,
that,
you know?
I wish I had hours to talk to you. I have so many things to ask you, so many things to admire you for. But the bottom line, you guys, that I think we've learned from Dr. Younger is that we are not living the natural life that we're intended to live. And if we can get back to being more natural in the way that we eat, in the way that we fast, in the way that we sleep, in the way that we are in touch with nature, with each other, your body will be healthier. It's
With the
go ahead.
rhythms of the day and the seasons, right?
Yes, all of it. So basically, it's the best way to avoid disease, and it's also basically avoids premature aging. There is so much to learn from Dr. Younger, and I can't thank you enough. We barely even cut it, Dr. Alejandro. I'm Greek, and when I go to Greece, I eat nothing but legumes and olive oils. I'm in the ocean every day.
It's my favorite country on the planet. I
And
I
I
spent
make my I
I
make
spent time in I spent time in Paxos and in
love it.
Mykonos, and all we did was eat
My
octopus.
family is from Tinos, Greece, which is an island that you can swim to from Mykonos, and I go there every summer. So I know what you're talking about. I feel the energy there, and
And I
I
ate octopus every day.
the best, the best. I
Very
want to
bad.
thank you so much for your time. I wish that I could talk to you a lot. For those of you that haven't already heard or known about Dr. Younger, you must look him up. He is going to teach us how to live a more natural way, be healthier from the inside out. It impacts your skin, your cardiovascular system, your sex life, your sleep. And I want you to look up his book, Clean 7. He is an amazing person, and he's one of the few people who's been able to scientifically bridge traditional medicine with functional medicine. And he is not a quack. He is the real McCoy. I adore you.
Thank you so much. And I'm gonna have we're gonna contact you about sending you some stuff for you to try.
Please do it. And for those of you that didn't hear, he works with a company called Organic India, which is an amazing harvester of pure Ayurvedic herbs. It's all very different out there. Don't just go to your grocery store and buy things because the time of day, the way the seeds are cultivated. So I really appreciate you and all the work that you do and making all of us better and healthier. Thank you.
Thank you so much.
Bye.
Bye. Thank you.